Hey, this is Jeremy, and today we're going to be talking about open and closed-ended questions. Now, open and closed-ended questions is a really important thing that we need to be able to differentiate between the two because it's going to allow us to have a better understanding of our patients, our interview tactics, and the way that we obtain the information that we need. Because again, a lot of our job is part of information gathering and able to dissect that information into usable pieces. So two big tips. Avoid using open-ended questions whenever possible, especially if it's in an immediate situation where you need immediate answers. And always utilize the patient's own words. So if you get called out for chest pain and you arrive on scene and they have chest discomfort and they describe their discomfort as tightness, well then don't say that they have chest pain, because that's going to cause your patient to have to repeat themselves. It's going to increase frustration between the relationship, the rapport between you and your patient, and that's not necessarily the best thing. So always utilize patient's own words and try to avoid open-ended questions whenever possible. Open-ended questions, they're going to require thought, and they're going to allow your patient to tell a story. So that can be important, especially whenever you're trying to get a picture as to how everything started. So if you say, well, tell me what was going on whenever all this happened, or what all medications have you and your doctor talked about? Well, those are open-ended questions because that's allowing your patient to be able to tell a story, and that's important. Now, if you ask, are you allergic to anything? They can say, yes, I am allergic to something, without providing you any additional information, such as if you can tell me, hey, can you tell me what all you're allergic to? Well, that's going to be a little bit more ambiguous, depending on how the patient wants to look at it and say, yeah, well, me and my doctor, we talked about I'm allergic to shellfish and seafood and latex. Oh, excellent. All right, well, that kind of gives us a place to start. Closed-ended questions. Closed-ended questions are not specifically yes or no type answers. Closed-ended questions can be very pointed. It can be this or that. Do you want me to listen to your lungs or your heart first? That is a closed-ended question. Okay. If you say, what do you want me to assess first? That's kind of leading into more of that open-ended question. So ask your patient, are they short of breath at all? No. Excellent. Then I don't have to worry about the breathing so much. And that's an important thing to kind of be able to differentiate. The closed-ended questions, they are going to allow you to perform a very pointed interview, very specific to whatever it is that you're assessing for, and it's going to allow you to look at those questions and tailor them towards that specific situation. So, for example, if I have a chest pain patient, and I've already established their vital signs and everything, and I ask them, hey, are you allergic to aspirin or nitro? No. Excellent. I know that I can give them aspirin. I know that I can give them nitro, which are both part of the chest pain protocols. Now, if my next question, if I know that I want to be giving those types of drugs, hey, have you had any erectile dysfunction medication? No. All right. Well, okay, that's good. Now, if you ask them, hey, have you had any Viagra? And they say no, well, maybe they took a Cialis instead. So erectile dysfunction medication is a little bit more specific than one specific brand. And so utilize those open and closed-ended questions to your benefit and allowing you to take greater care of your patient. Another example would be if you have a chest pain patient, does your chest pain radiate to your left arm? Which that's pretty common. Well, if they say no, well, excellent, then I don't have any other information to go off of. But if I say, do you have any other discomfort, or does the discomfort go anywhere, or does anything else feel weird? At that point, that's an open-ended question. It's allowing your patient to describe how they're feeling, or what it is they're feeling. They're like, yeah, it doesn't go to my left arm, but it does radiate into my back. That's information that I never would have been able to obtain if I said, does your chest pain radiate into your left arm? And that's important. So understanding open and closed-ended questions, that is paramount to how we operate as EMTs and paramedics, because again, our interview tactics, the way that the rapport that we establish with our patients, the way that we communicate with our patients, their friends, their family, our coworkers, that's very important, and it's all going to help us take care of our patients And at the end of the day, that's what all this is about. So that's the difference between open and closed-ended questions.